Hey guys, welcome back to my YouTube channel, Basic Medical Sciences. Today we will see the management or treatment of bronchial asthma. Uh, Bronchial asthma, a case of bronchial asthma can come to you in emergency or it can come to you in OPD. If it comes to you in OPD, then you have to classify it according to severity. Now, on the basis of severity, it can be intermittent or it can be persistent. Now, in order to see whether it is intermittent or persistent, we have to see according to following factors. If the frequency of symptoms is less than 2 times per week, and if these symptoms disturb your sleep or you awake because of these symptoms at night less than 2 times per month, and if it does not interfere with your normal activities, and on pulmonary function tests FEV1 is greater than 80%, and you use short acting beta 2 agonist or bronchodilators less than 2 days per week, then it is intermittent asthma. Next one is persistent, and persistent asthma is further divided into mild, moderate, and severe. If the frequency of symptoms is greater than 2 times or it is more than 2 times per week, you awake at night due to these symptoms 3 to 4 times per month, and it minorly interfere with your normal activities, and on pulmonary function tests FEV1 is greater than 80%, and you use bronchodilator or short acting beta 2 agonist more than 2 days per week, then it is mild persistent asthma. And if frequency of symptoms you have frequency of symptoms daily, and you awake due to these symptoms more than 1 time a week, and it interferes with your normal activities, and on pulmonary function tests FEV1 is ranging between 60 to 80%, and you use short acting beta 2 agonist or bronchodilator on daily basis but once a day, then it is moderate persistent asthma. And if you have these symptoms throughout the day and you awake at night time 7 days a week, and it severely interferes with your normal activities, and on pulmonary function test FEV1 is less than 60%, and you use short acting beta 2 agonist or bronchodilators throughout the day, then it is severe persistent asthma. Next is guidelines to treat asthma. Now, GINA guidelines, Global Initiative of Asthma Control guidelines, are given in order to treat or manage the case of asthma. Now, these guidelines are based on step up and step down treatment. And in order to apply these guidelines, first of all, we have to classify the asthma, and then we have to treat it according to the symptoms. Now, there are 5 steps of these guidelines. What are these 5 steps? And we have to apply these 5 steps on the basis of the symptoms. If it is intermittent asthma, then we have to apply step 1. What is step 1? That we have to give short acting beta 2 agonist, that is salbutamol, that is a bronchodilator, to a patient. And if it is mild persistent asthma, then we have to apply step 2. In step 2, we have to give short acting beta 2 agonist. Second one, we have to give low dose inhaled corticosteroid, that is beclomethasone. And third one, we have to add leukotriene antagonist, that is Lucast, montelukast, or zafirlukast. Now, what is step 3? Step 3, we have to apply to the patient who have moderate persistent asthma. In step 3, we have to give short acting beta 2 agonist, we have to give long acting beta 2 agonist LABA, and we have to give low dose inhaled corticosteroid. And in step 4, we have to apply step 4 to a severe case of persistent asthma. In step 4, we have to give short acting beta 2 agonist, we have to give high dose inhaled corticosteroid, we have to add leukotriene antagonist, and we have to add oral theophylline. And if these symptoms are of severe persistent asthma are not recovering or not improving, we can add step 5. What is step 5? All these drugs which are used in step 4, we have to use these, and we have to add one more thing, that is oral steroid, that is prednisolone. Now you have to follow up after 2 weeks. If patient is improving with step 5, then taper down oral steroid. And if patient is improving in other steps, then continue the treatment for 3 months and then step down the treatment. Like if patient is improving with step 4 medications or step 4 treatment and he has used it for 3 months, then step down the treatment to step 2 or step 4. And if patient is not improving, then step up the treatment. Like if you are giving medications of step 2, then if it is not improving, patient is not improving, then step up the treatment to step 3. Now, what is the aim of GINA guidelines? The aim of GINA guidelines is to bring all the asthma patients to step 1 treatment, that is short acting beta 2 agonist. Now let's see what is acute severe asthma. Now there are two types, whether it can be severe attack or whether it can be life threatening attack. How can we see that it is severe attack or it is life threatening attack? If the patient is unable to complete even a single sentence, it is severe attack. And his respiratory rate is greater than 25 breaths per minute. His heart rate is greater than 110 beats per minute, and on peak expiratory flow rate, its rate is less than 50%. And what is life threatening attack? The patient will come to you, he will be exhausted, confused, and when you will examine, his chest will be silent, his pulse will be feeble, his respiratory effect will be poor, his partial pressure of oxygen will be less than 8. On peak expiratory flow rate, his rate will be less than 33%, and due to very low partial pressure of oxygen, pH of the body will be less than 7.35, and on ABGs it will reveal patient will be in type 1 respiratory failure. Now, what is the investigation of choice in case of acute severe asthma? So the investigation of choice in case of acute severe asthma is ABGs, that is arterial blood gases. Now let's see the treatment of acute severe asthma. If the patient will come to you in emergency with severe attack, first of all, there is resuscitation, and then you have to administer 100% oxygen inhalation with salbutamol 5 mg, add ipratropium bromide nebulization, continuous nebulizations, then add injection hydrocortisone, and don't forget to do chest x-ray to rule out pneumonia or pneumothorax. And if it is life-threatening attack, then add injection magnesium sulfate, which is 2 mg IV over a period of 20 minutes. And in case of life-threatening attack, magnesium sulfate is drug of choice. And now if the patient is improving, shift the patient to ward, step down the oxygen inhalation from 100% to 40 to 60%. And before you were giving continuous ipratropium bromide nebulization, now shift it to 6 hourly. And before you were giving injection hydrocortisone, now add oral hydrocortisone 8 hourly. And if the patient is not improving, continue 100% oxygen inhalation, repeat magnesium sulfate 2 mg IV, add aminophylline infusion, which is 5 mg per kg IV, and if patients still do not improve, then ventilate and intubate the patient.